Hey everyone, I wanted to pop on here today with a colleague of mine, and I'm going to wait for her to come on. And we're going to talk about pregnancy and reflux, pregnancy and heartburn, natural solutions, because we all know the medications, right? That's what's so accessible to all of us. Thanks for joining, guys. Gonna wait for my colleague, Dr. Beth Waller, to come on, and we're going to chat about pregnancy and reflux. This is a topic I know several of you guys have asked about. Here we go. Here's Beth. Buddy. Hey, how's it going? Did it go? Hey, she's coming. Woo-hoo. Hey.
Woo! It looks so dark in my room compared to yours.
Yep, that's okay. Hey everyone, I'm Dr. Shana Keller, and this is my colleague, Dr. Bethany Waller. Are you going by Waller? Okay.
Yeah, that's great.
Great. And we wanted to chat with you guys about some natural remedies to help with reflux during pregnancy, because there's not much you can do about that bun cooking in the oven that's just karate chopping your stomach and other organs, I'm sure too, right?
Right. The intra-abdominal pressure.
That's right. Okay. All right, guys. So, Beth, where would you want to start? Like, what is your go-to when you're dealing with pregnancy reflux?
Yeah, absolutely. I think some of the first things I think about are what we do every day. So eating, of course, preventing common triggers of reflux. So all the foods that may potentially be triggering, which, of course, the major caveat is not everyone is triggered by the same things.
Totally. Yep. Some people can eat tomatoes and other people can't, although tomatoes is the most common one I see. Spicy food, carbonated beverages. Oh my God, carbonated beverages are huge. Everybody loves their sparkly water, right? Hey, everybody, thanks for coming on. Everybody loves their sparkly water. But I'll tell you, when you already have increased intra-abdominal pressure and then you add that carbonation, it's only a matter of time before that bubbles right up, right? Like, that's just physiology. That's just going to happen. Like, don't be surprised.
Yes. And some of the common ones, of course, are usually not applicable in pregnancy, like alcohol, but chocolate, definitely the carbonation, coffee, maybe or maybe not.
Yep, for sure. Yep, chocolate can definitely be a big one, especially if a person already has predisposition to reflux. Like, for example, if I was pregnant, I would be a little more mindful about some of these things because I have a history of pretty severe reflux. So I would be just a little extra mindful of that.
Yeah, absolutely. People who have it before often have some idea of what it's like.
Yeah.
Some people have never ever had it in their life, and it's the first time that they've ever been experiencing it. So it can be a big surprise at how painful it is. And it's most common in the third trimester, but it can happen anytime.
And I've definitely had patients that have had it like from the very beginning. And I know hyperemesis gravidas is not what we're specifically talking about, but like that nausea and vomiting can kind of go in that same category in my brain, which is really awful. My sister, with both of her kiddos, had it really terribly. So, but before we've kind of talked about some of the basic things, and hopefully everybody knows those. And if you're seeing a regular doctor, they're definitely telling you avoid the triggers, lift your bed up by 6 inches, go for walks after meals, blah, 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 all like that stuff. We kind of want to talk a little bit more of like the things that you don't hear very often. And I want to start by dispelling the myth, because I did a quick Google search and whoa, it was really intense. Because, by the way, licorice candy that's artificial flavored can now cause high blood pressure. That's interesting. So it's not licorice, it's the artificial flavoring. I'm not really understanding this. That doesn't make sense to me. I'm calling some BS on that is what I'm calling. So I want to talk about licorice and DGL.
Sure.
DGL is something that I haven't seen a lot of benefit with people with reflux, but some of my patients have. And it did not help me. I know some of my other colleagues use it quite a bit. It's like the go-to, like, oh, you take Tums, take DGL instead.
Yep. It's funny, pretty much everything in pregnancy I find works for some people and doesn't for others.
Totally.
And so it is definitely something I talk about. The DGL being deglycerinated licorice, the alkaloid that gets a bad rap, of course, that if in super high doses causes major liver issues.
And it's super high doses, people. It's like
super high doses is the caveat. Yeah, but it's not even present in the DGL, so it's safe for most people to at least try, especially in between meals when the burning is the worst.
Yep, exactly. Like after the meal, exactly. So if I were pregnant, I would be taking DGL if I found it to be helpful, and I wouldn't be worried about it, because like I said, that quick Google search I gave me was like, whoa, this is very alarming that people are reading this, that not only DGL is super unsafe and candy's unsafe, and they're just mixing all this stuff in. It's like, it's just gobbledygook. This is why working with a professional that actually understands what is going on is so important. Someone like myself or Dr. Bethany.
I completely agree. Google is not the best, especially when it comes to pregnancy. And one caveat that I talk about, again, with all of my patients is there's no studies in herbs in pregnancy, because that's not best practice. Scientifically, we're not doing right studies. But traditional use of herbs, both from Western, Eastern practices for hundreds of years, we know what's generally safe. Again, generally safe for each person, doesn't mean everyone.
Right. So definitely don't take anything we're saying in this as like advice to you. We're not saying you should take this. We're saying you should consult with your doctor who has an understanding of herbs. And unlike one of my patients who just went to see a specialist in a really fancy medical establishment, she was like, what do you think about me going to see a chiropractor? And he was like, yeah, you're wasting your money. Here's Miralax.
Whoa.
Okay.
Wow.
Okay, so like, let's keep that in mind, that your regular practicing medical doctor may not have that experience. Now, and I say may not because Aviva Ram, she's a medical doctor, and she was an herbalist before she became a medical doctor. So she has a much better leg to stand on than, someone that has no herb experience at all. So
absolutely. I recommend her book and resources a lot. Yeah. And, with the DGL thing, it's worth a try. Similarly to triggers, similarly to other herbs that might help for, reflux or nausea and vomiting prevention.
Exactly.
Sometimes it gets worse, sometimes it gets better. There's always a little bit of trial and error, especially when working with herbs, to see what resonates most with you.
Exactly. So, and we've all probably heard ginger at some point. Ginger tea kind of settles things. It can definitely be aggravating for some people. So again, like, you got to know that different component. And Bethany and I were chatting just before this. It's, I definitely prefer teas over tinctures. Tinctures are made in alcohol. Now, if you're already doing tincture, like, you're in charge of your own health. I really do put that back at people when they come to see me in my private practice. But a lozenge or a tea, you don't have to worry about the alcohol or any of that, and it's just going to have a little bit of a sweetness taste if you get some candies or some lozenges, I guess. Do you have a brand you prefer?
For teas or lozenges or otherwise?
For any ginger products. I mean, I guess I would just recommend Traditional Medicinal's ginger tea. I think they have like a ginger aid.
Yep, that's my favorite tea for sure. And I'm a big fan of glycerites, the non-alcohol. Of course, ginger's a root, so it's a little bit harder to extract what you need, but sometimes they'll kind of powder it and mix it into the glycerin, which is a different base that is not alcoholic and generally safe for pregnancies and kiddos.
Yeah. Tastes pretty good too. It's a little sweeter, kind of balances the spiciness of the ginger.
Absolutely, yeah. And some people can feel right away, oh yeah, that helps a lot. Or if for whatever reason it seems to be more triggering, fine, I move on to the mints, which get a bad rap too because they can also cause heartburn.
Yep. Yeah, and I do think I found that there is a difference between peppermint and spearmint in their efficacies here. For people that have a history of reflux, peppermint's on that list of like avoid peppermint. And so I was like, no mint at all, because I was like, oh, mint, they all do the same thing, right? No, they don't. They have different areas of affinity in the body, and so spearmint actually works down here in the lower digestive system as opposed to up here in the upper. So it can be soothing for some people, especially, constipation kind of gets mixed into the whole pregnancy thing, right? You got like something sitting on all of your organs. Not the most fun. It'll be fun.
No, I love it.
Maybe it will.
I love spearmint.
Yeah, spearmint. What do you think? And have you used peppermint successfully with women struggling with reflux during pregnancy?
Yep, okay. Absolutely. And for some people, once in a while, they do great on ginger, and then it stops working. It's not as effective. Mm-hmm. Your body's like, okay, fine, I'm still nauseous. Switching it up can be super helpful.
Totally. Yeah, one of the things in Dr. Aviva Ram's book that I just showed, she recommends, there was actually a study she said, which I thought was really interesting, chewing 8 to 10 almonds as an anti-nausea or anti-reflux agent, which I thought was really interesting. So that might be something.
Yeah, I wonder about that because the only other big thing that I talk about for prevention, which this is probably the only time I ever recommend people eat when they're not hungry, is to eat small, frequent meals before you actually feel hungry, especially for the nausea part.
Yeah.
Absolutely making sure that there's a source of protein in those mini meals or snacks
Hmm.
can actually prevent the nausea because it tends to be the stomach acid sitting there on its own by itself causing that nausea.
Totally, totally. Yeah, and like maybe that's why the almonds are helpful because like they have some nourishment, they've got some calcium in them, so maybe there's something there.
Yeah, the
And
minerals.
old mentors, she was a midwife for a really long time before she had some health issues. Stop. And she really likes gooseberries. And this is in the tomato family, the Solanaceaceae, so some people might have some negative reactions here. And again,
Oh, I didn't know that.
I haven't tried this, but chewing like a handful of them, and they're these like little golden berries. Chewing a handful of those seem to really help with nausea. And I'm putting nausea and reflux. They're kind of similar. You know, the nausea can lead to reflux. It just depends on what the person's susceptibility is.
Yeah.
So those were some
Yeah,
like
that
weird
one was an
ones.
interesting one to me because I've never tried it myself or
Mhm.
recommended to patients, but I'd be curious to see if anyone out there has done it.
Totally. Yeah, me too. So if anybody has used gooseberries or almonds or, you know, I just love to hear different people's perspectives. And there's so many different cultural, you know, like I've got a colleague that is from India and there's some things that they have tips and tricks there, right? Like there's so much variety. And that's the beauty of social media is it connects us to people from across the world with all these different good ideas. Um,
Absolutely. I know I love their bitters after meals.
oh yeah, bitters after meals. You know, I'm a fan. I'm a fan. What do you think about visceral manipulation?
Absolutely love it.
Absolutely love it. I fully agree with you. Visceral manipulation. For those of you that have been on my channel for a little while, I've talked a little bit about it periodically. And, you know, is it safe during pregnancy? 100%. Absolutely, it's safe. Like the amount of body work a pregnant woman needs, everything's being jostled around in the abdomen. You're getting kicked in your kidneys. Your back is whatever. Like you're sleeping like in weird positions, right? Like all of these things kind of get a little disjointed when we're growing another human in our uterus. So I'm a big fan of that. Make sure you find a professional that is properly trained in visceral manipulation. Do not go to someone that let their
Right.
license lapse. I'm not a fan of that. Like at your own risk if you go to
Right.
someone that has their license lapsed.
Yeah, and I think for me, I always tell patients perhaps it's a massage therapist, perhaps it's an acupuncturist or a chiropractor who has
Mhm.
specific visceral manipulation training. And if
Exactly.
people don't know what that is, it's hands-on manual therapy that's very specific for organs. And
Mm-hmm.
so, of course, the esophagus, stomach, whatever might need a little hands-on support. And it's one of those things that you kind of have to keep up with.
Mm-hmm.
But a lot of people can have really great relief during
Yeah.
pregnancy.
Absolutely. And, you know, the practitioner I work with here in Montrose, he's been practicing visceral manipulation for over 20 years. And he actually, on new babies up to 2 years old, he will do free treatments. And I don't know that all practitioners, like some of us just have certain things we really, really love.
Yep.
And so find your person. And when I was doing the training for Visceral, a lot of physical therapists actually were
Mm-hmm.
involved in the class. I would say maybe half of
That's a
my
good point.
colleagues. So that was interesting and like not what I would expect because the physical therapists I've seen are like not into that stuff. So
I forgot. I think there are up here in Denver. There are a lot of physical therapists that are really interesting in integrative support stuff.
yeah,
So,
yeah, yeah. I mean, it gives them so like maybe some of you guys have seen me do that hiatal hernia adjustment where you
uh-huh.
have here and down. That is a technique that I learned from an ND who took visceral manipulation training, and that is a direct technique that you can do on yourself. But what's great about working with someone, a practitioner, is especially if it's been a really stressful pregnancy, which I know a lot of women struggle with for one
Yeah.
reason or another, like that's just there's some things out of our control. Working with a body worker can help you regulate your nervous system, and
Yeah.
they will do a lot less of those direct adjustments, and mostly they'll just do a little bit more of like releasing and, you know, letting things feel more unwound,
Yes.
released, unwound.
I think of it that way too, kind of an unwinding.
Yeah, exactly. It's weird. Visceral is a weird thing. It's like massage for your organs without it being like deep tissue. And if you've had craniosacral therapy, it's sort of like that, except for your abdomen. And they can even come up into your thorax, like Dr. Bethany was describing, and doing some adjustments on your esophagus, which they feel bizarre, but feel so good at the same time.
Absolutely. And I think that's a good, this is another topic I'm sure we want to talk about at another point, but digestive issues in general and that connection with the nervous system, super aided by body work.
Very, very much so. I fully agree. And like that was my next little bullet point, was to talk about grounding and breath work. Is like we don't always have the finances to explore herbs. We don't always have the finances to go find a body worker. And as much as I'd love to advocate for those, you know what doesn't cost you anything is breath work and grounding. Put your bare feet on your grass in your yard, or if you don't have grass, go to the park, go wherever, bring a bottle of water with you, put some water down, put your feet in there. Or if you're lucky enough to live someplace that has a river or a lake, someplace that you can put your feet in, like that can help. I know that's like, yeah, but I'm having reflux here. It's not on my feet. Yes, but the nervous system, when we can let the nervous system relax, sometimes that can be really, really, really helpful for these conditions.
Oh, absolutely. I was explaining dew walking recently, and I forgot about it for myself.
Oh, it's so lovely.
It's so lovely in the spring.
It is lovely. I mean, I'm a big advocate. My morning walks, I try to go for those walks because having this weird static electricity thing happening. Carpet, not a fan of carpets. Side note. But doing some deep breathing, and it doesn't have to be like too deep breathing, but breathing in and out through your nose. And again, that's one more way to start regulating your nervous system. And I always love to show this because it's always amazing. Like I talk about the SCM squeeze. So do you hear the tone in my voice has just shifted? Can you hear that?
That's interesting.
Because you're stimulating your vagus nerve. Like it blows my mind every time. And yet one more thing, like
I bet it feels good.
It feels great. You don't
I haven't done it in a while.
You don't have to pay money. And so we have various ways of things being accessible. And if finances are a problem, try some nervous system techniques, try some breathing, get your feet in the grass, like, or in a mud puddle, if that's what your yard is. Like, you know, use what you got. That's the rule. Any damn old thing will work if you just use it. Use it is worthing better than nothing. Any last tips or tricks or things that you've seen be really helpful?
Oh, I guess another big one that's out there, and I think I know your opinion on it, but I'm curious about counseling around something like a slippery elm or marshmallow. Oh, I don't mind if people use regular teas, but I know that there's althea gruel, that's marshmallow, that you can kind of mix in with your breakfast especially. But how do you talk to patients about that?
Yeah, I mean, a lot of people aren't partial to the gruel and like the name gruel, right? Like basically what it is you take slippery elm or marshmallow root and you mix it in with enough water.
Powdered
It's powdered, and then you basically like eat it. And you can mix it into your oatmeal or mix it into whatever you want. I'm one of those people that's just like get it over with. So I'm like chug it down. Like just
take it like a shot.
Take it like a shot, exactly. So you want it to be liquid enough that it's like, you know, kind of gooey texture, like applesauce sort of.
Right.
I'm a huge advocate of this, especially if there's nighttime symptoms. I talk about this on my free reflux guide. And if for whatever reason you can't tolerate that, traditional medicinal's throat coat tea is really helpful for this. It's got the gooey mucilage. That's what we're going for here, is that gooey mucilage, and it just helps to absorb and also coat. So if you know that eating gives you reflux, because it just adds a little bit more pressure and you're in your late stages of pregnancy, having a little bit of that gruel beforehand is a game changer. And you know, I always talk about the different types of aloe, and yet there are still people that are like, oh my God, I got the whole leaf aloe and I understand why now because I had explosive diarrhea. Do not take whole leaf aloe when you are pregnant. Do not fucking do it. Do not. You heard it here. Do not do it. Inner leaf is safe to take during pregnancy. It's the same effect as marshmallow and licorice. It's just maybe a different flavor, right? But like, do not take the whole leaf. Do not do it. I don't know how else I can be more clear. You've got to look at the ingredients, and if the label on the bottle or package does not specify inner leaf or whole leaf, don't buy it. They are not a good company. Yeah. They are not trustworthy because they are not being transparent. I don't know if you've seen the frozen aloe cubes in the grocery store, Beth. Have you seen those? Yeah, I've just experimented with them. They're inner leaf, and they're like little frozen cubes. I didn't feel like they were super gooey, but hey, you know, we'll see.
Yeah.
We'll see if there's a benefit there, because it's always nice to have different ways of approaching this, especially now it's summer, and like if someone is hot, they might want a cooler beverage instead of this weird gooey stuff. But maybe you could make ooh, I bet you could make ice cubes with it. popsicles.
I bet that would be good.
I bet that
And
would
we
be
were
good.
talking about the licorice drama because licorice is in the traditional medicinals, and
Right.
licorice is a
Good point.
pregnancy
Good point.
tonic in a lot of traditional medicines.
Mhm.
There are certain, of course, endocrine conditions where we don't use it, but that's why you talk to us about it.
Yeah. Yeah, I guess that's a really good point. Is there enough licorice? I mean, if it was me, I would still drink it, but I also have an extensive background with herbs, and I
Sure.
know I'm not worried about it for myself. But when you go on Google and you read that, like, oh my God, this person drank licorice one time and they got high blood pressure and they died.
Right.
I'm gonna say there was some other things going on there, probably, without knowing anything else. I will refer you to my astute colleague, Dr. Eric Yarnell's blog, botmed.rocks. He has a whole page, multiple pages about licorice and the
Or
data.
tell your doctor to use it because
Tell
he,
your
he
doctor.
made that
Tell your
one
doctor.
specifically
Tell your
for
doctor.
practitioners. But
Yes, it
yes,
is
it
specifically
has
for
the research
practitioners.
cited. It's where we get a lot of info.
Yeah.
And it's a super great resource.
Yeah. Yeah, exactly. So I'm not scared, but also this is why you need to work with a professional so that you know where those boundaries are. Anyway,
Absolutely.
so
And
we
your
give,
personal comfort level, right?
yeah, exactly. It just gives you that little bit of relief that you're working with someone that has your best interest in mind and they want to make sure you're safe and little one is safe too. So we talked about licorice, we talked about DGL, we talked about ginger, we talked about tinctures versus glycerites. We talked
Yep.
about some weird ones like almonds and gooseberries. So if you guys have used those, let us know. We're curious. We talked about mints, spearmint, and peppermint and how they could have different benefits, as well as the whole usual thing with reflux. So, I don't feel like we need to reiterate that here. And then things that are, we talked about visceral, and then we talked about grounding and breath work and the importance of those things in healing a person's nervous system when they're dealing with reflux. So anything else? We'd love to hear your questions and comments. So thank you so much for joining, everybody. Thanks, Dr. Bethany.
Yeah, thank you so much for having me, Dr. Shayna.
Bye.